Yeah. This is good. Yeah, you too.
Anyway now. And Dr. Kurt, you don't need to if you don't want to, because you're going to be picked up by this camera over there. So you're talking.
Says okay. Happy New Year. Welcome. You're turning it off and I'll turn it back on.
Tom, can you hear us? The audio coming through for you?
I think there's two Toms on, but yes, I can hear you.
So much.
Hey, Tom, you got your message this morning? We'll talk soon.
Sorry, Greg, you're breaking up a little bit when you speak.
So I've got to talk, I've got to speak. Maybe I should sit in that chair. Do we have anybody? Who said, so sit.
Also, it's right next to you if you go to your. Jukebox.
We still have people coming in, so we're gonna start a little after this. We do have a meeting. I said the same thing 10 minutes ago.
It's hard. The first week, everyone's back in January. One, two, three, four, five.
Right then. This is the first Board of meeting, Pitkin County Board of Health meeting of 2024. We have a forum here. We've got Liz Stark, we've got Dr. Tom Kurt, we got Tom Bridstein in the line, and has anybody else joined, or is that all of us? So we do have a quorum and we can begin the meeting. Was that the roll call? Is that not calling to order? We are flying. Any corrections or approved to keep the minutes? And if anybody has a comment, I move for approval. And a second from Linda. All in favor? Aye. Aye. Okay. We're ahead of schedule already. I'm going to open it up to public comment if there's anybody public or staff. I'll invite staff if anybody wants to say anything. That would be their opportunity. I don't think we have anyone in line to go warning. Right? Okay. I'm gonna leave that open for a little bit. I know I'm so used to doing board comment right after public comments. If anybody has a quick what they want to say, you mind if I insert that?
Can we round out at the end?
Yeah, round out, which is always good because we'll all have thought of something. So. Okay, and would you like to say anything? Hey, John. Moving down. I'm looking forward to people presenting. I know that Amory Levens had contacted us. I'm not sure whether he's coming or not. Not today, but we discussed it and I think we're going to get to that in a future meeting in about today's. There she is. Hey, Krista. Dr. Giesel walking in the door. City council is here. Okay, my only comment just at the beginning is as we just got into a pretty strong respiratory illness season. My family got hit. Somehow I avoided it all, which was amazing, but I know the community's really kind of been hit. And we'll probably get that update during today's meeting. So I won't belabor it, but it's on everybody's mind. And I always wonder, what could we be doing to make things easier? And so we can discuss that when time comes in the meeting. Hello, well, glad you're here. Okay, so we've got Krista here. Also, John is our alternate, correct? Great. Ooh, that's not going to be good.
It's okay. It'll probably still pick up.
I can do it. Fishing.
Yeah, I was just.
Everybody wants to go to the market together. Yeah. That just bought me an inch.
There you go.
Great, thanks. Okay, can you still hear me, Tom, out there? Is that a yes? Okay. I didn't see
Yeah,
that.
it seems a little bit better. Yep.
Okay, having exhausted things to say with public and board comment at the outset, I'm going to go to the director's update and hand this over to Jordana.
Good afternoon, everybody. Happy New Year. We've got just a couple recurring things that we put on our first meeting of the year that we need to go through. And the first is to adopt the 2024 meeting schedule. So we brought this during October as the dates we that we will be meeting in 2024. And just need the board to approve this. So these will officially be the days that we will meet in 2024. We need a motion to adopt.
Let me just, I want to what the encourage everyone to do the same, only because I wanted. On the 11th of April, there's a good chance I will be in DC on behalf of RAFTA and Pitkin County. But will you be here? I guess that's the question in that case. If
I'll be here, but
we may, maybe it'll be. Okay. Just we ask for the rest of them if they, it looks good for me.
I would just make a comment for this meeting next year. The second Thursday of the year is packed with meetings from every organization. I literally am scheduled for 6 different meetings today.
Second Thursday of the month.
Of the month,
Yeah.
of the year, the year. I mean, everybody's getting, nobody really has a meeting that first week, and then everybody has a meeting the second week. So maybe next year, if BOH doesn't need to meet on this Thursday, that maybe we do it a week later.
Okay, so the proposal is for 2025. Should we move to third Thursdays?
You know what, that might be a good thing. Also, the second Thursday of every month is actually just jam packed.
the second and fourth are lighter for you guys.
Not the second.
I mean, for the first and third.
And it's really just this, it's just,
This month.
it's just this.
For you, yeah, so, I have this delivered every second. Okay, thank you for that. Thanks for bringing it up. Back to you. Do you need a motion to approve? I need a motion to approve this calendar.
So moved.
We've got a motion that I have a previous motion. Kurt, second. All in favor?
Aye.
Great, thank you.
Beautiful. The next thing that we always go through on our first meeting of the year are the working agreements. So we took a bit of a deeper dive last year in reviewing and updating these. So we can just take a minute and look through the agreements here to see if these are still what we would like to agree to going forward, or if there are any changes that folks would like to see here. So they are, in order to promote good decision-making and public trust and confidence, the Pitkin County Board of Health has adopted the following working agreements. One, we agreed to define expectations of the meeting, so the purpose, the agenda, time commitment, and come prepared. We agree to respect each other's diversity and voice. We agree that any member may differ on any issue. When that happens, we commit to work effectively together by disagreeing openly, respecting difference.
Sorry, I don't know why it stopped. Go back.
Before perfect. And being tough on the issues and not on the people discussing them. We agree to work as a team on behalf of the community. We agree to make decisions by consensus when possible and to respect the majority position of the board when consensus does not exist. We agree to transparency and appropriate communication with staff. We agree to be respectful and professional with Board of Health members and staff. We agree to base decisions on science, research, and best practices, and we commit to considering equity when making decisions. Any comments or requested changes by the board?
If nobody has one, I'd like to just share something that I see happen on boards, and I don't know if I've ever seen it happen on this board. This board runs so well. And our members are so conscientious. Often I see what happens on boards, that it's really easy to take a position to poke holes in something, before you've really understood the proposal on the table. We don't come forward with a lot of innovative proposals to consider. Usually it's pretty well baked before it gets to us. But just my personal concern is that we vet an idea, or we hear it completely before we look for reasons why it won't work. And I just find that to be a much more pleasant way to have a meeting and a conversation. Because so many good ideas die before they have a chance to breathe. And I don't know if we need to write that into our meeting, but it just makes things more comprehensive, and I think it certainly is a much more pleasant way of having a meeting. So I'll just say that, and I don't think we have to amend our working agreements, but I just find that to be really great, because I don't know how many board meetings I go to where something worth talking about comes up, but it gets legs kicked out from under it before it has a chance. And so let's not do that here. Thank you.
Thanks, Greg.
Mhm.
And there's one more slide here that just goes through also just some of the agreements as they relate to procedures. So agreeing to make time to meet as agreed and to be fully present during the Board of Health meetings. We agree to forward communications through the public health director. That again goes back to the sunshine laws that govern board not calling a public meeting out via email, essentially, unless it comes through me and goes out as a one-way communication. We agree to request open discussion items again through the public health director or chair, and then agree to review working agreements annually.
Could we just get a little, while we're on the topic, regarding sunshine laws, and communications between members? We're not suggesting that board members can't talk to each other,
Correct.
but we have to do it in such a way that it doesn't become a public meeting. So that means, two board members can have a great conversation, but if it's three, then that becomes a meeting which ought to be noticed and public. And all of our other boards have to work that way, and it's just something to be familiar with, and I think you're all probably used to it. Just thought I'd bring it up. It's a way to stay out of trouble.
The other reminders, there was a question that came up about parking reimbursement. So if you are attending a Board of Health meetings, we do have dollars to reimburse you for that. I think it just depends on the cost of parking. It's less expensive to park in the garage. If you want to save those receipts and submit them at the end of the year, we're happy to process them. Just take a picture of your receipt and send it along to me. Parking charges for attending government or nonprofit meetings as a volunteer, if you're here in a volunteer capacity, may also be tax deductible. So you could also ask your accountant about that. And then the request for saving them to the end of the year, we're happy to reimburse it, is just because it does cost the county $15 to cut a check. So we're wanting to make sure that we're giving it a good bang for the buck and just not writing a $2.50 check 4 times a year. Yeah, so if that's something you're interested in, just email me and we'll work that out. The other reminder is just that there will be another annual Board of Health training. So everyone here is probably pretty used to these online trainings now that come out. You'll get an email from the Office of Public Health, OPHP, Public Health Planning and Local Partnerships. With the training that they have just made for this year, and my understanding is the format's a little bit different, but it hasn't quite been released. So probably sometime between now and our next meeting, that'll come out, and you've got this entire year to be able to take that. So if you have any questions as they come up, feel free to let me know. But that's just an effort to make sure that all of our Board of Health members have the training they need to be in this important capacity.
I have a different system for parking. You know, it's all digital these days, so if somebody's coming into a meeting, we could probably get their license information to parking department and get a pass. We'll talk more.
Yeah, let's talk.
Okay.
We're in the city, so
There's an easier way.
I'm sorry, people connect.
Okay. Was that it? Parking.
Very important, very important. Strategic plan, if there's no questions there yet, I will just hop right in. So pleased to share with everyone our strategic plan. Last time, when we talked through the budget, we did share our overall priorities for each of the different departments within public health. What we'll be working on in 2024, but did want to share the 2024-25 strategic plan, which we update every year, but really did big priorities come every 2 years. And we really look at this as what are we working on across the department as a whole, and who's taking which pieces. So if we want to move through to the next slide, you will see that the first goal here is really around communications. So our first strategic plan goal is to increase community engagement and awareness through communication of evidence-based public health information, ensure we are known as a trusted source of information in the community. We have the next slide really goes through some of those action steps that we're going to be taking. So we'll be updating the public health website. That will we haven't really done that comprehensively since we were first formed as a department. We have since added some information about communicable disease when we sunsetted the COVID website. But that can really use a lens of making sure that it's accessible. There have just been some new requirements that have come out around accessibility and being ADA compliant. So we'll need to make sure that is happening, as well as making sure that it is available to folks who are primarily Spanish speaking. So we've got some website work ahead of us. The next piece, which you're more familiar with, still on that slide, one back, Nancy, thank you, is around the communication plan for priority health topics. And so this is something that is pretty exciting, since we haven't really had a comprehensive communication plan in a while. We have Katie Stetson, who will be here presenting a little bit more of those details on that communication plan. And some of those priority health topics that you all helped us to prioritize back in the latter half of last year, as well as we'll have some updates around also adding the letters, the kind of op-eds from public health. We have been working with the Aspen Daily News, and they are eager to have a sample on some of those topics that align with our communication plan, and have that be one of the channels that we're reaching out to the community to really make sure that we're rebuilding some of the trust. We know that COVID helped us to establish trust with some elements of our community. It also, across the nation, had the effect of really weakening some of the trust and with folks when they think about public health. So that's part of our goal when we're thinking about communications. The third activity there is really based around building relationships across different interest groups in the community. So another kind of COVID learning was that it allowed us to build and strengthen some incredible relationships in the community. So I think we really strengthened our relationship with community health services, with the hospital, with the school district, with some of our law enforcement partners. I think, that list can go on. But we've also realized that we never know what the next public health emergency is that's going to come up. And so the more that we can have relationships already established with different sectors and affinity groups in the community, the better we're positioned for, like, when MPX came up and we needed to be in touch with our LGBTQ community, Right now, we're trying to work with the community around the Venezuelan migrants that are coming into the community and what kind of resources might be needed there. So the more that we can establish those relationships up front, the better we're going to do to be able to jump into the work and not have to build relationships while trying to do the work. So that's really, that's our first big goal, some of the actions around it. Any questions?
Yeah, can I just ask you a
Yeah.
question about it? 'Cause this is just from my day job. We get a lot of the Mesa County public alerts when it comes up, like there's measles in this county, there's mumps. How do you guys face, like, how is that relationship between Mesa County, that getting sent to the doctor's directly guys?
So are those the HANs, the Health Advisory Networks? So those come from the state. They come to us about exactly any communicable diseases or things that our providers should be looking at, or knowing about, thinking about how they should be. What kind of diseases might be in the community, or a variety of different health topics. Those come in, and it's usually Nancy's job to send those on out to our providers, our local providers, so that they get that information as soon as it gets distributed to us. And so we keep that mailing list up to date for our local providers.
Is there a feedback loop so we know if they're getting a message? They know if they're getting the message, we know they've received it.
Well, that's what I'm interested in, because my husband's been. One of us ended up on Mesa County.
Right.
I'm to the VA.
Kurt, I have to.
Hi, I think, so we have the providers list that we keep hold of, and maybe it would be easier, I could talk with you offline about getting you on that providers list. We do try to update that on an annual basis, but a lot of times we end up with dead links, things like that, that we take off. So we're always trying to actively keep that updated, but we can add, if we have somebody off, we can certainly add that. Like, we can just talk after the meeting.
That would be great.
Jordan, I wanted to step back just a tiny bit to your comment about rebuilding trust. I have to say, from my experience, my perspective, having gone through COVID with the board and even since, I think this community has had an easy go, but because we've had a good relationship with our public health, and it hasn't always been easy. There's been a lot of attention and scrutiny, but even still, compared to many of the communities, this board and your staff and our community has come through it very, very well. So I'm not sure if we need to rebuild trust, but I love the idea of building relationships, and just want to highlight that. So. Liz.
I just wanted to comment, I think during COVID, you guys did an amazing job of building relationships with the business community, which, you know, that probably doesn't need to be, but there's just something that was really unique, I thought, at the time to build those relationships. And in my time doing this job, I remember, and I'm sure all these are on your list, but I'm just thinking of the faith community, which was always a really weak link back then. It may not be as much now, and veterinarians, because for zoonotic or crazy things like that, it's like we need them sometimes.
Yeah.
So I just wanted to put those two things out there.
Absolutely. Thanks, Liz.
Dr. Kurt, did you have a?
Yes, I had made a suggestion when I was interviewed by Ariel about an op-ed done by a different member of the Board of Health or department once a month in the Aspen Daily News. And the editor has changed there now, but they wanted a sample of a column, which is being right about 500 words. And, you know, I'm willing to start that, but I'm not interested in doing it every month. I'd like to sort of get the initiative, because that's sort of a trust with the public too, that you have with a monthly public health column written by someone different on a different subject. And you can have at the bottom, you know, telephone numbers and emails that you can contact related to public health sections.
Great, thank you, appreciate that. I mean, but you alluded to that earlier, but that helps.
Yeah, and we'll get into more details and we'll be asking for volunteers for those columns, and especially the first sample one. And the frequency that we have agreed to work through is about quarterly. for this year to see how it goes, and then we can adjust for the coming year.
Thanks for just keeping us on.
And volunteers.
Fantastic. The next goal number 2, is around staff retention. So we can't do any of this work without our staff. So the goal here is to actively sustain and retain the right size public health team. By promoting an inclusive, positive team culture and through training, planning, and communicating the value of public health. That's really what we can do internally, as well as maintaining funding for these positions. So we move on to the activities. You'll see that we'll be thinking through this year's succession planning. So thinking about when we do have some folks who have positions that they are planning on moving on from. How do we have capacity? How do we understand all of the things that they've been doing so that we can train and continue to perform at a high level there? We've really honed in on a recognition plan we know that one of the things that continues to motivate folks, in addition to the salary that they get, is understanding, how what they're doing is contributing to the greater whole. As public health, we have a greater whole to contribute to, and then also recognizing everyone in the way that they can most appreciate. So we've been working through what that will look like for the team in 2024. We'll continue our equity, diversity, and inclusion efforts. So we have an EDI team who just had a retreat last month. It has a number of training and other efforts that we'll be taking on, as well as every staff member has a line item of their individual development plan that has an equity focus. So I'm really proud of the department in the way that they're integrating the equity work into what they do every day. As I mentioned, we need to sustain the funding and the positions that we either have or have planned for to be able to do this work. We'll continue to focus on positive workplace culture and team building. And I did want to share that we just took an employee opinion survey in 2023. And just a couple of the results that I wanted to share were that 100% of public health staff who responded indicated that they either agreed or strongly agreed with these 2 statements. One was that my supervisor treats employees with the kind of respect a person deserves. And the second one was my supervisor at Pitkin County understands the importance of personal and family life. And so I just want to take a minute to recognize the amazing supervisors and managers that we do have in the department. And they are really putting a lot of effort and thought into how they do this work, which in turn helps us sustain and then retain employees.
Thanks, Jordan. If I could, as we have elected officials at the table here who are responsible for the overall budget for the county and the city, I think we all have to scrutinize the budgets, and we're not always easy on public health or others. Through the state mandates and the pandemic, public health departments grew dramatically in our county and elsewhere in the state. And of course, that raises the eyebrows of our constituents. So I want to say that while we recognize the need for public health, I also need to see, for me and for the people I represent, that always and across the board, the money hopefully is being spent wisely, and we are prudent in our thinking. And so that I think that ought to be included in every one of these conversations, because I think there have been, I'm going to say, in both industry and in government and public life, we have people who like to build departments bigger because that was a measure of success, building the department bigger. And I never want to be accused of that growing it bigger was one of our goals, but maybe it's a necessity, and here's why. And so I'll be asking for help with justification of everything we're doing, because I feel it's my job to be the skeptic. And I think others on my board would feel and say the same thing. I'd invite Tori and John to weigh in if they feel like it, or Tom, who's online, because if that's part of our responsibility. If you want to add anything, fine. If you don't, I'll just be the Function.
I'm good.
I think you said it well. Thank you. Appreciate it.
And I think just to illustrate, when we started the pandemic, it was a new department that had been formed in 2017.
4 employees.
Right, with 4.25 employees, we were up, we hired, and at the peak of the pandemic, we had upwards of more than 30 employees. And back when we had only those 4 employees, we had done a study of how many folks we needed to have a right-sized department for the community. The goal was to build up to that slowly. Obviously, didn't happen during COVID, but we have, as of July of this year, we have achieved that right size for what we needed, which is around 16 or 17 employees. So, even though we had grown to that size, that's not the goal, is to sustain a huge workforce for public health to be effective. We're really looking at what do we need to do to help achieve those critical, those core public health functions, as well as achieve what our community expects of us, and also partner with existing agencies who already do this work, so that we're not creating additional functions. For example, when the department was formed, Community Health Services had always been providing those nursing services. And so we continue to contract with them to provide those services, as opposed to hiring our own nurses to do mandated immunizations.
Thank you for that. I appreciate the explanation. That might be part of an op-ed, because I think most of this entire board was present at watching the growth of public health and the demand and the need for it. And so we've all kind of been there and observed this, which is kind of an anomaly from the typical non-pandemic MO. So thank you for that.
And I just want to say too, that the positive work culture that you've created during a time where public health departments really were decimated by public opinion is a testament to your personal journey. So for all your work.
The board are being supportive.
And somehow you maintain composure throughout the entire.
Brings us to our third goal, third of 3 goals, and that is around COVID learnings. So we really want to take this moment where we can step back and take a breath to institutionalize those COVID learnings in order to be better prepared for the next public health emergency. And so we go to the next slide and we'll look at some of those activities. We'll update our emergency plans. So we're required to have a number of different response plans that we submit to the state. We are also going to do some work on a staff training plan to know what our staff should just be regularly learning as it comes to time to be prepared for additional emergency response. And finally, another realization we've had is that all of those emergency plans that we're required to do and submit don't really delve into enough detail around communication. We've learned that communication is such a huge part of any public health emergency response. And here locally, we've learned a lot. We've learned a lot about our partners, who the right people, who the right sectors are to be getting out information, the channels that we have. So we really want to take some time to be able to document that down for our own use. So the next time we're responding, and you're in that response mode, you're not always thinking very critically. We can go back and think through what are all the channels, what have we used before, who are the partners, and be able to ask the right questions, and maintain those learnings that we were able to come to through the COVID response. Hopefully be a little bit more nimble with that.
Questions, comments?
I'd like to see some kind of an interim news network to do once a month to the Board of Health members. Maybe if you would review the CDPHE, CDC news and sort of update us with what you think is going on, and so that we have an interim kind of news going on between meetings.
So can you talk about so we do a monthly update to the Board of Health? What What else would you like to see in
Could you
that?
comment on what the CDC and CDPHE specifically is doing?
In all areas?
And just sort of a review of what they're doing to update us.
I think that it's a nice suggestion. I just want to make sure it's not a huge burden. And is there some other way we can do it if it becomes, I don't know how large of a task, the burden that would be, is it an hour's work or is it a day's work?
Each person then could be given the CDC listserv and sign up to be on it individually.
Yeah, if they're already creating an update, you could just tap into that.
I'm certainly happy to link to those existing, you know, if there's an existing monthly update from CDPHE or CDC, so from
There's
CDPHE.
something they call
Clinically based on it. Maybe more for you and me though. What sorts of information, like, for example, over the past year, the stuff that you have read from those, what would you think we could have read on this board that would have been helpful?
I think all of us have a kind of constituency that talks to us about what's happening in the community, and they sort of expect us to really be updated, you know, with all information. So I think that's what would keep us in that kind of a category. The experts have to be more aware than the constituents.
And I think, you know, when we just look back at the requirements for being on the Board of Health, because public health is so broad, we really look to fill different roles, some with, you know, medical from the medical lens, some with just understanding what's happening in the community. Mental health is another area we're looking to fill, community representation. And so I think it's, I would just want to make sure that we can provide information, but what we're expecting of different Board of Health members is to bring their own lens, which will be different based on their area of expertise and provision.
And I think that even this fall has been confusing as a practicing provider regarding vaccines. So I would prefer people be directed to their doctors to talk about some of this, because it is getting to be somewhat nuanced and somewhat individualized.
I can think of one example, just the CDPHE website that has the data about influenza rates, COVID rates, RSV. I think they've now included RSV in some of their data collection. So, you know, in your monthly updates, and you've got a respiratory section, I think. You know, the link to the CDP, that page on CDPHE that kind of shows that state data. And I think that's where we find now even Pitkin County's data is on the state website. So that might be one example of just kind of, you can zone into Pitkin County, or you can kind of look at the whole state, see what's going on.
Absolutely. So,
And CDC has a great influenza page too, if you really want to look nationally. They have a similar, if you want to go, and that's just specific to respiratory illness.
Vaughn? I just want to make sure I'm not dumping something.
Yeah.
no, I mean, just trying to hone in, because I think, you know, communicable diseases is one thing that CDPHE does. They have, you know, departments that do everything from motor vehicle accidents, tuberculosis. We have suicide prevention, there's environmental air quality, water quality. So there's just as much work as we do in public health at the local level, the CDPHE is doing at the state level. Around all of those different topics. So happy to link where it's helpful and you all are interested in looking more, but also don't want to provide too much information and have it be super overwhelming.
So if I had a particular interest in looking for, say, highway accidents, public health reports on Highway 82, for instance, I can find that somehow or get help from you to find that.
Exactly.
Great. I'll be asking for that.
And that is it. for the strategic plan. So I just wanted to make sure the board was updated as to that. Thank you for those comments and feedback. Those additional partners, Liz, we've got that on the list because I don't think we were thinking about our veterinarians yet.
Oh, yeah.
And we will be that's what we'll be working on this year.
Okay, so that's it. Or
This is, I don't know if we've formally voted to adopt it before. We can.
you can always, I just need a motion. Need 425 strategic plan, second.
I can move that.
Got a motion from. And second from Linda, on favor. Aye. Okay, you're official. All right, communication plan, moving along here, and I want to point out that we're minutes of our schedule. Thank you.
Hi, everyone. I'm Katie Stetson. I'm the Health Promotion Coordinator, so I'll be taking over this part. Thank you for having me. Talking about our 2024 communication plan, and then a little bonus as well, our current seasonal illness campaign, so you can see what we're up to right now. Could I have the next slide, please? As Jordana mentioned, she went over some of our communications goals already. So these are a little bit more fleshed out, our 2024 comms plan goals. The first one is to have an accessible website that's managed internally by public health and regularly updated. Our second goal is to have our social media accounts, primarily at the moment, our Facebook and Instagram, managed by public health as well and regularly updated. Our third is to conduct the media campaigns that are promoting public health and environmental health issues within our $1,300 budget. And our fourth goal, strong community partnerships and connections to sectors of the community with relatable representation. Feel free to stop me at any point for questions, unless there's anything else. Could I have the next slide, please?
Katie, before you switch to thinking about social media, you'll have a manager, is that you perhaps, who's going to be posting relevant topics from public health on a frequent basis? Is that how that would be? Just want to, how often would that get it? Is it something that those of us who are on those social media platforms would share or be encouraged to share?
Absolutely. We post per topic. So I would say there are some topics that come up only once or twice in a year. Something may be sent to us by the state that's important for the moment, and we receive a toolkit from them. And so it's maybe going to come up 1 week in the summer, maybe promote it twice in the whole year. Those things, as they come up, they can easily be reposted by any of our followers, and it'll link back, it'll tag back to public health and show that we, as public health, were the original posters. So at any point in time, anything that we post could be reposted by any of the board members, any of our followers in the community as well. And that's a wonderful way for any of you folks to support us and just spread the word. Our following is fairly small on each of these platforms, and so the wider that we can spread it, the better.
Right, I was just going to suggest Pitkin County's Public Works Department is active on social media, and they'll post whatever the snowplow crews are doing. And it's infrequent, but maybe it's weekly or bi-monthly. But it's really useful, and I enjoy sharing that because it really helps people. The Open Space Department, I think, shares even more often, maybe weekly, with all the relevant news regarding open space or trails, things like that. And I find that really valuable, and people seem to respond. So if you're looking for models for frequency from the county, you might look at a couple of those. Public Works and Open Space are the ones that comes to mind, but if you haven't already, just take a look at them.
That's wonderful. Thank you.
Are there current Pitkin County Public Health Facebook sites? Are we adopting one in the future, or the one now?
Good question. We have, okay. I
How
don't know.
do we become a friend?
I'll do that in an
You
update.
could friend all the members.
But if you just type Pitkin County Public Health, you can search for it and follow.
Thank you. The media campaigns will be newspaper ads, I assume, or public radio or commercial radio. What we've heard, who did we hear on the radio?
Right.
Carly's been in these stations lately. I really enjoy hearing.
That's right. Carly's been on the radio. She's been on local TV with Aspen 82. Myself and Rosa Sacedo have made some Spanish language commercials that have also been on the radio channels, and some interviews. La Nueva Mix and La Tricolor interviews there as well. So there's more details. Don't worry, we'll get there in just a minute. Can I have the next slide, please?
The top of the gondola in the morning.
So before we go too far into seasonal illness, we'll wrap up our work here around the 2024 communications plan topics that the board helped us to solidify, as Jordana said, the end of last year. So what we're looking for at this point is some more support. We have these broken down into quarter, and the topics that are highlighted in purple are opportunities where we'd love to have a champion from the Board of Health step up beside us and do some work to the media, to the paper. We could also integrate anybody's faces and voices into our social media campaigns. That's another opportunity. And we'll dig into that in the future, but especially for today, we'd love to have some help. We have a sign-up sheet there for you folks. So love to have some help of who would like to write an article for the paper. And there's several opportunities. One per quarter would be sufficient. And I would like to comment that we have Dr. Levin, who's going to step up for our gun safety campaign in June and has volunteered to help us with that at this point.
This is good. I'll sign up, or if I forget to sign up, consider me signed up.
Excellent. Could I have one more slide, please? There's a condensed list. So if you have something in mind, please hold on to it. And as the sign-up sheet comes around today, go ahead and add your names on there. Any questions about support opportunities? Any further suggestions as topics come up, or ways that we can partner together with any of you individually are always welcome.
Remember early in my term on the Board of Health, I testified in Denver on tobacco issues. And it wasn't part of something like this, but I found it really satisfying to do that. It was really a good experience. And I would encourage anybody on our board to do that, whether on any of these topics.
And if those policy opportunities come up, we will definitely let the board know, and that's kind of more the work that Ariel's been working on.
You know, that's something else I'd like to bring up. I'm on several boards and involved with several advocacy groups and lobbying groups. And it's much more than I can personally handle myself. But they'll ask me if I would like to go lobby on the oil train coming through Glenwood Canyon, or on tobacco, or on any other topic. And they'll often provide me with bullet points and that I can then form into a letter or into a testimony. And I definitely work my own version of it, but it's so helpful to have that. And I assume that you'd be doing the same and providing that to staff if they, you know, if they decide to stand up and go and testify somewhere or write an op-ed. We'll have support. Is that right?
For Board of Health members?
Yeah. Okay, great. Thank you.
Thank you. Can I have the next slide? We're going to move into the seasonal illness campaign, the currently active campaign right now. So these goals are specific to this campaign. We want to disseminate useful and timely information related to seasonal illness to keep the community healthy and informed. We want to be known as a trusted source of information in our community and to bring some personability. Specifically into this campaign, we've worked hard to have our team's voices and faces, as we just commented, appearing on the radio and on local TV. So kicking that off really strongly in this campaign, and that's something we'd like to continue into future campaigns as well. May I have the next slide, please? Here's a couple of snaps of the local TV interviews. We had Carly and Dr. Kim Levin on there, right at the top of the mountain on these cold mornings. We really appreciate everybody who's joined in, and we have subject matter experts from our team as well as community partners who will be joining us as we continue these interviews through March. Next slide, please. These are a couple of examples of the print ads that are currently out. We have English print ads running weekly and Spanish print ads running bi-weekly, just in different print cadences in the different papers that they're in. We added the QR code, and we also adopted a website URL, pchealthnews.com, as just a condensed website to help us be able to verbalize how folks can get directly to our page. So those are featured on both these ads here. Can I have the next slide, please? We just got some current data yesterday about how it's going so far, and there's a couple of exciting pieces in this campaign just because of the size of it. We have some Google filter ads. So if anybody in our zip code Googles vaccines, they get a specific ad that will pop up and they can click and they're directed back to our website. So in English, we've had 2,000 of those impressions, 200,000 of those impressions so far, and they've returned 2,400 clicks. In Spanish, we've had 56,000 impressions so far, and they've returned back 654 clicks. And in this campaign, we also added Pandora and Spotify digital radio. So folks who are listening to the digital radio in the car, and if they're on a version where they're listening to ads as they go, they have a chance to hear these ads multiple times. So Pandora Radio has 4,059 listeners, and they're hearing our ads about 1.7 times each. So totaling 7,218 ads there on Pandora. And then Spotify Radio at 3,392 listeners, and they're getting it at about 6 times each. So those folks are hopefully really hearing our message, and the total there on Spotify is about 20,000. Any questions here? I can give a little more idea of how these work if anyone's curious.
Don't see any hands up. Let's keep moving. Thank you.
Perfect.
Thank you very much.
Exactly. We have, thank you. Yeah, we can go ahead and play. This is an example of a brief commercial we're using on Aspen 82, and we're excited about these assets. We have a wonderful vendor we're working with, and we're excited to have these assets that have all been refreshed that we'll have for future campaigns. Next slide, please.
We didn't hear audio on that, but does that matter too much?
I think you get
the idea.
Just
Okay. Thank you. This system here is way too complicated for me to.
That's all right. It has a charming jingle in the background.
Okay. You can just hum along.
Yeah. We're happy to have media support. So there was an article picked up by the Aspen Times just December 28th that kind of indicated what we were looking at in illness after the holidays upcoming. So it was wonderful just to have support and a little more widespread news. And then here's an example of one of our pop-up ads, the Google targets that you could see if you're looking for anything in Pitkin County. Next slide, please. Just some examples of our regular media channels. We're using Aspen Daily News for paid ads, the Crystal Valley Echo, and the Sol del Valle. Our radio stations include KSPN, The Lift, Radio Free, K-Snow, Aspen Public Radio, and in Spanish, La Nueva Mix and La Tricolor. Our social media channels on Facebook and Instagram, and our local TV sponsorship currently with Aspen 82, and then it's reposted on aspendailynews.com. And I just want to say a big thank you, although not in the room. Sarah at Trans Mountain Media has been a wonderful partner in helping us put such a huge campaign together in a very quick timeline.
And I will just share another huge thank you to Katie for taking this on. We got very accustomed during COVID to having like a media team that would help us through the county, and with the ending of the emergency, we also had to figure this all out on our own. So Katie's done a wonderful job of stepping up and into that space.
Great job.
Thank you.
Thank you, Jordan. Thank you all for having me.
Yeah.
Hi, everyone. No, I think rolling right along to the hot topic of the hour, following on the heels of such the amazing media campaign that Katie's really been taking lead on. So next slide, please. Gonna just kind of go over the really brief sort of data updates first, and then delve into a little bit more specifics about our vaccine coverage, and follow up with sort of a wrap up of where we are now with sort of like the response and all the energy that we're kind of giving to COVID at this point in time. Real quick, RSV, we're pretty fortunate this year. It was not as critical as the RSV surge that we all saw last season. So last season, just a reminder, at about this time, we were still very much reeling from the amount of pediatric hospitalizations in the state of Colorado. We saw that impact locally. RSV last year was certainly certainly a big bad, and you can really the data on the state respiratory disease dashboard, which is relatively new this year, it kind of combines all three of those big respiratory illnesses, COVID-19, flu, and RSV. That dashboard is on the right hand side here if you're interested. That is new this summer, so you can see there's no RSV data on this, but I'm sure everyone can attest to sort of that impact that RSV had last winter season. There were some predictions, and certain states, particularly in the Southeast, did suffer really critical waves of RSV this year, but fortunately, Colorado seems to be through the thick of it. RSV seems to have spiked not only locally, but also nationally. So there's still a possibility that it could make a comeback, but at this point, we're hopefully looking at downward trends for most of RSV, which is excellent. Flu and COVID-19, these two, as ever, are ones that we are keeping our eyes on. Flu this year has certainly caused a little bit more of a stir than last season. So this really is our second year with flu on the scene alongside COVID-19. And so last year, flu made a blip. It was present, but it wasn't really severe. This year, even looking at that graph on the right-hand side, you can see that it is still trending upwards. That graph can be a little bit confusing. That vertical line that's on that right-hand side, everything past that point is for this current week. And so that data isn't fully collected yet. So don't look at inherently those really steep downward trends. Really to pay attention to that kind of vertical line. And we can see that flu really is continuing to spike upwards. That's not just the case in Colorado, but that is the case nationally as well. Flu activity is quite high everywhere. We are truly in the thick of flu activity. Locally, what that means, the kind of the comparison between flu and COVID-19. COVID-19 is also everywhere. COVID-19 is trending upwards throughout the country, including locally. And during that holiday push, we really did see an increase in COVID-19 cases. Fortunately for us, or unfortunately, depending on how we're looking at it, we actually haven't seen really severe cases of COVID-19 this season. We haven't seen any hospitalizations for COVID-19. That being said, we have seen hospitalizations for flu. So just want to highlight that these two things are co-circulating. They are posing a risk, particularly for high-risk individuals, individuals who are 65 plus, unvaccinated individuals, or individuals with other underlying healthcare conditions. So I do just want to call out that flu has kind of caused a bit more of a stir this year than last year, and that right now we're looking at flu currently, potentially being a little bit more severe this year, even than COVID-19. So kind of a fun, not a fun takeaway, I should say, but definitely looking at a different disease paradigm compared to those really COVID-19 heavy seasons. Any questions on sort of this big picture, high level update? Oh, I think someone's talking, but I'm having a hard time hearing you.
So how many, hyperproviders, one or two? Or just that one, three?
Well, the question was, is all this traceable through the septic system? Can they trace this in sanitation the way they were monitoring COVID?
You are giving such a good segue. Can I get the next
Well, it's
slide,
really
please?
good, because you get it a little bit earlier, and you get cases that are not necessarily reported because people are doing that.
Sorry, that was a little broken up and hard to hear, but so for the
So Carly will answer because the next slide is all about wastewater. So she will.
perfect. Okay, then we're going to jump into wastewater. So really good question. Our wastewater data, as we kind of went over the last couple months, has been pretty static, if we're being entirely honest. We've been at this pretty low rate, but I do want to call out what occurred last week. So on average, we know that our wastewater data is really critical. It can give us near real-time data points, but we also know that it is really challenging at this point without really robust data sets to make educated insights into what our wastewater means. So flu and COVID-19 is very much traceable through the wastewater system. We are looking into 2024, the expansion of this wastewater program to look at RSV and flu, but we're just not quite there yet. So hopefully next season, when I'm coming in front of you to talk about wastewater, I got all three to look at. But right now, COVID-19. So on January 4th, a sample was taken from the Aspen wastewater district. This was relatively routine. And if we look at sort of that right-hand top graph, we could see that dark blue dots are pretty static at a pretty low level. And so that included over a really busy holiday season. Over those 2 weeks between Christmas and New Year's, we didn't see these really large spikes in activity, even in our wastewater data. Enter January 4th. January 4th broke a state record. It is the highest concentration of viral copies per liter out of the entire state. Pitkin County and Aspen wastewater in particular actually held that state record for prior to this, and that prior record was 2.8 million copies of virus per liter out of Aspen. The one on January 4th was 9.6 million. Just to put this in a sense of scale, I did add the Snowmass wastewater sample data on the bottom there, and we could see the variation in the scale of 9.6 million copies of virus to where Snowmass is, which is right under 500,000. For the rest of the state, all the other wastewater sample sites are pinging at around 20,000 to 600,000. And so 9.6 million is quite the jump. So this pinged not only interest from CDPHE, it pinged my interest, but it also has the interest from the CDC. And there are currently two running primary theories. So one, the lab did verify the sample, so there was no lab error that occurred in this sampling. That being said, that doesn't rule out mistakes along the chain. So potentially there might have been an error with the machine itself as it collected that sample, or there's some anomaly going on with the Aspen wastewater sanitation district that could lead to a higher flow rate, a higher concentration, anything along those lines. So there's a few different mechanical and very manual issues that could have happened that people are, or, excuse me, that everyone is trying to work through to try to get to an answer to this. The other option, and again, there's many different options, but the other running theory is that there has been a mutation in the virus that allows the virus to be shed through fecal matter at a much higher rate than previous mutations or previous variants. And so what that basically means is that the same number of people are sick, but they are shedding more water through more virus through their GI tract. And so these are the two running theories. There is a lot of investigations going on into this between CDPHE, CDC. We're following up with Aspen Wastewater. And all of that goes to say is that we're not entirely sure why this happened. We also really don't know what it means. We do not know if it means that there's just more sick people. We do not know if it means that there's another variant. We don't know if it was just an accidental collection mishap. And only more data will tell. And so right now, I don't have very many good answers. And it might take months if we ever get an answer at all. So just want to kind of call out those two pieces, and that hopefully we're getting more data tomorrow. So the second sample from the earlier this week should be being analyzed. And if we don't get it tomorrow, we should get it on Monday. And it'll be very interesting to see where that next sample is from or where it lands in this scale. So
Dr. Kurt and Dr. Giesel seem to want to weigh in, chime in on it, but let me hear what they think about that anomalous data point.
Well, my question has to do about the possible mutation, because Snowmass and Aspen are not two distinct entities. And so I think for that to be a possible mutation, we would have seen the same anomaly occur with the Snowmass wastewater as well.
I think we have to take into account, we're an international community, so we're not Prague or Meeker where we're a bucolic community and no one is coming in. We have 20 flights coming in and out each day, and like 3 flights to Dallas, from Dallas every day. One family coming in from Dallas or one destination like that, I think could cause this anomaly.
And Liz has something.
One sick family, I think.
Liz, what?
It's probably pretty obvious, but I mean, do you correlate, or does anybody correlate this to occupancy rates? I mean, I think it tells the story all by itself, but is there any real correlation going on there?
Yes, but it's really challenging to get a handle on occupancy and what that actually pertains to number of visitors. We're really fortunate that we do have the transient inventory study that was published last season that we have been able to integrate into some of this data, but it is a little too early to tell. And ultimately, it still wouldn't explain this rate of increase, if that makes sense. Because
I mean, it's just like this Snowmass and Aspen are the same.
Yeah.
Like,
I don't know. I've always thought.
Typically, you have variance. It could be one end of the curve when that was that way.
Right. Thank you, Carly. It's fascinating, but I think we should keep moving because I don't want you to go over my schedule being anticipated.
I would hate to do so. And so I will say that this is something that I don't have very many answers on, and that I do just want to reiterate that one spike, one data point does not a trend make, and nor does it make a crisis. So which brings us into the next slide. So talking about our seasonal vaccination uptake. So we talk about sort of where we are at COVID-19 and the various risk factors, and vaccination is obviously one of our highest tools. Just want to highlight that this data was pulled at the beginning of December. So this is not the most up to date. Hoping to take this data and actually compare it to after the seasonal illness campaign runs. So looking at the impact, hopefully, of that seasonal illness campaign, how many vaccines we were hopefully able to give out during that time. So not from this month, but from last month. And just want to highlight again, talking about scale, looking at the change in our vaccination uptake over the COVID-19 season. As we can remember, way back when we were still in our initial dose series, we had near 100% vaccine uptake in the county. As of December 4th, this has dropped down to 6.5% of all Pitkin County residents having received the seasonal COVID-19 vaccination. That's the one that got approved back in late September. This is technically lower than the United States average of all 18 plus vax rate, the 18 plus vax rate across the United States is at 18.9. So just want to highlight those numbers are a little bit different because I took out all of our population, all of our eligible population, and not just the 18 plus, but we are seeing lower uptake locally. Distribution is higher amongst our highest risk community members, though, and this is a positive thing. We know that this is a similar trend that we see in our seasonal flu vaccine rates, that those individuals who are at that higher risk level, especially our 70 to 79-year-olds, have really shown out to receive that vaccine, and that the national average for 65 plus years of age adults is 37.2%, and that we can see that in that category, our county really does kind of push beyond and above that national average. So our most vulnerable are likely to be more protected than elsewhere, but our overall vaccination rate has declined. So what does that mean? Next slide, please.
The correlation with wisdom.
I like that. Oh.
Be vaccinated in Garfield.
Oh my gosh, I am so sorry. I think I accidentally put 2 of these slides out of order. Nancy, I'm so sorry. Could you jump down 2 slides? Thank you. I apologize for that. I don't know how I put those out of order. Totally my fault. So one of the big questions that we had during the vaccination rollout was the lack of providers in Pitkin County and who was actually able to receive a vaccine locally, right? A lot of our messaging was about the idea of thinking ahead, thinking about when you're traveling potentially down to Garfield Canyon, or down to Garfield or going to Costco or any of these places where those larger, more national pharmacy brands were located. Looking back at this data in December 4th, though, we can actually see that over 50% of our population were able to get vaccinated locally. With that, that's not a bad number. For the number of times that individuals have to go Mid-Valley to buy groceries, to visit their physicians, to dental appointments, whatever the case may be, 50% of the population who wanted to get vaccinated were able to get vaccinated within locally, which I think speaks kind of volumes to the effort provided by the medical providers in the area. Can we see the next slide, please?
I'm sorry, I have to weigh in here because we were going through this this fall. And I found it very frustrating at one point. I think I probably expressed that to Jordana and everyone else that would listen, that finding a vaccine in the fall in Aspen wasn't that easy. And I didn't like the answers I got from the doctors and community health. Getting phone calls returned, all that was pretty frustrating for me. And I'll probably be bringing this up again with them. But I think there's room for improvement, and I'm glad to hear that this chart shows that we're doing okay. But I know people were having a hard time finding vaccine, and then also when COVID was happening, finding care for it. I know Paxlovid, which is the antiviral, was pretty hard to come by, and the answers, it just seemed it's really frustrating to be an Aspen local, but realize we have to go far afield to find what you're looking for. I'm hoping we can delve into that. Thanks.
Yeah, no, and I totally hear you. I don't want to discredit the fact that especially those few weeks. Oh, nope. Yeah, I'm so sorry. One more slide, one more pie chart. So 2 more. There it is. So speaking of those providers and sort of speaking to your point, Greg, about who individuals are calling, who was actually providing vaccines, realistically, the vast majority of our vaccinations done locally were by City Market. So we can see as a population, City Market administered about 50% of our vaccinations. And then on that right-hand side, there is that graph breakdown of City Market specific locations. So looking at the one located in Aspen, looking at the one in Willits, and then down in Carbondale. So big shout out to the City Market pharmacy crew, but I also want to call out in particular Community Health Services and Aspen Valley Hospital. They made up another massive chunk of these vaccination efforts. And so really want to call out that our providers, our medical providers, typically struggle to kind of catch up with this vaccination system, and call out that the providers who were able to vaccinate this season did so kind of on an uphill battle. There was a lot of unknowns about this vaccine rollout, what it would look like as it pertains to kind of payment structures, ordering systems, minimum orders, and all the rest. And so all of the providers who really kind of took it by the reins and charged ahead despite a lot of those unknowns, really kudos to them, because there was a lot of unknowns. And I think it, to your point, led to a confusing vaccine rollout. I think it created barriers to individuals being able to make those appointments, unsure if they would be charged out of pocket or not, and unsure of where they can even get one. And so I hear you. But I do think that a lot of our local providers, especially AVH, especially CHS and City Market, really stepped up to the plate and administered a good chunk of those vaccines locally. So when we look at our population of 18,000, roughly, and which local providers were able to administer those, it really came down to those three players. So kudos to all of them who were able to assist with that. But that was kind of the end of the vaccine talk. Any questions on sort of vaccinations? I think thinking through kind of strategies next year, I was just going to jump into sort of what the Pitkin County Public Health kind of role is in response at this point. Happy to kind of talk about it a little bit more there too, if that makes more sense.
And I just want to also comment and give some kudos out to Carly, as well as Community Health Services, who is really our clinical arm, who for coming together early on, recognizing what the rollout was going to look like. It wasn't going to be this smooth transition. We're going back into our existing medical system, and the decision was, this is the capacity we have. Where do we focus that? And so, I think rightly so, looking at population health, we wanted to focus on those that were most vulnerable. And then if we look at who in Pitkin County was vaccinated by age, that over 60, 70 age demographic was our highest percentage of age group that was vaccinated. So while it might have been, difficult for a lot of folks to find a vaccine, the rollout was tough. We had some providers who really stepped up. We look at protecting the health of the population, protecting our hospital system. I do want to give kudos to being able to look at that and affect pull the lever that's going to have the biggest effect in that area. And to Carly's point, we do think next year we should have some more of these bumps figured out.
I can give a perspective from my personal job, which is that we at the VA did have trouble getting vaccines this fall, and I think I brought that up at a meeting. I also believe that our data is really good, and that this is a disease that we are finding that most of the hospitalizations and death occur in people that are very old with a number of comorbidities. I think that even now the vaccine is much more readily available, there is not an increase in the uptake. And we are doing a great job with our public health campaigns, and I'm not sure that's going to change minds at this point in time. So I think that piece has to be taken into account, as well as there is a little bit of fatigue amongst the community. People are not finding it as important. People are making personal choices, which is why we're seeing the vaccination rates there.
Are the VA vaccines being counted?
I don't see them on that chart. We just really got up in December, I would say, but it is a statewide database now where it is shared. Our data is actually for the first time shared with the state and vice versa.
The percentage might be increased, maybe 5%, so.
I doubt that much. We're trying, but.
Well, thank you for that.
Yeah.
No, thank you guys. And thank you for the comments. I'm so sorry, Nancy. And again, gonna go up 3 slides now. Apologies. One more. Thank you. So why the change in the COVID-19 response? I think that we are sort of all well aware that the changes have been made. I think one of the most actionable spaces that the community has felt this in availability of testing and vaccinations. To Greg's point, the idea of trying to gain access to these treatments is now fully encompassed within the medical system. And that's a challenge for a couple of folks, and not even, you might have your physician, you might have your go-to folks, but that is still makes it a little bit harder for the vast majority of our community to know where to go, to know where to access. And so why did this change happen? What metrics were we looking at? So as everyone here knows, the public health emergency ended in June 2023, and that this public health emergency declaration really was the mechanism that allowed the COVID-19 response to operate, to include functionally free to use testing, vaccination, increase in staffing, constant check-ins, not only on data, but also doing a lot of that contact tracing and case investigations, and all the rest. So all that big bulk out that I know we've kind of alluded to throughout this time, and that this whole party has been privy to throughout the entire process, was made by that public health emergency. Why did it end? Was it chosen to end when it ended, even though we know that we're still seeing really high rates of illness? We're seeing really high rates of transmission. Our wastewater data is a little funky this week, et cetera, et cetera. And the really big ones are that all those severity metrics that we're now looking at and tending to pay attention to more so than incidence rate at this point. So looking at hospitalizations, looking at deaths, looking at ER visits, have all been trending downwards consistently for over 2 years. And so those two graphs on the right-hand side, we can look at excess mortality. This is not deaths due just to COVID, so just want to highlight that, but excess mortality was one of the metrics utilized by the powers that be to really determine the overall health impact of the COVID-19 pandemic, knowing that COVID-19 didn't just kill actively, but it led to a lot of negative outcomes across the board. So when we look at that excess mortality over the pandemic, those are really high numbers. And that as we look down to that kind of lower right-hand side, that really steep drop-off was mid last year. Mid last year, excuse me. And so for the last year, we've functionally been at our average rate of excess mortality. And that was one of those really big trigger points to call an end to the PHE. Same with hospitalizations. That bottom graph is the statewide hospitalization data for COVID-19 in particular. It's a little bit higher this week, but not by too much. And we can really see how we've moved away from those incredibly high peaks, those incredibly steep uphill climbs for hospitalizations due to COVID-19. And while we are still seeing negative health outcomes due to COVID, don't want to say we're not, but they are not at that same critical level that we've been seeing throughout the pandemic response. So what does endemic COVID-19 look like? We continue to have respiratory illness seasons. And COVID-19 is likely going to cause more severe illness over the course of our lifetimes. COVID-19 is here for the long haul. We are going to live with this, and it's going to contribute to severe illness well into the future. Public health, especially Pitkin County Public Health, is here to educate, here to be that trusted source of information, here to really encourage vaccine uptake, here to really kind of provide that public awareness. All kudos to Katie for our respiratory illness seasonal respiratory illness campaign, and really act as that trusted source of information and kind of the spoke in the wheel, or the hub in the wheel that really directs individuals to resources to be able to access the care that they need. And then really encouraging individuals to engage with their healthcare providers to gain access to that care. Vaccinations, I know it's been mentioned here, but also previously, is that even the 3 vaccines that were available this year for RSV alone were incredibly confusing and could only be administered with a medical provider's oversight. And so that's something that individuals should go speak to their physicians about, as well as all these other vaccines that they can be getting. And that a lot of the efforts that we are now currently putting into is reframing COVID-19 in this endemic space, and continuing to be the kind of hub for that information on where individuals can go to get vaccinated, even if it's not a drive-through vaccine where we can do 3,000 vaccines a day. It is really trying to build this into what is normalization, what is normal COVID, what is the capacity that our healthcare providers locally are able to assist with, and really trying to fit it in there somewhere. So all of this together really is the push that public health, and especially us, looking at educating the community, communicating out to our community members about where resources are located, but not being the active response as it was through the last 3 years. I think that was it.
Okay, what's next? She has more.
I think that's it
Was
for
that it,
Carly.
Carly? Oh, you're done. Oh, thank you. Okay.
Right.
Wanted to make sure. Well, thank you for that, Carly. That's a lot, and it was useful, and it was helpful to see that. Where do we go from here? Where are we?
Next topic is Audrey. On the agenda. Hi.
Come on down, Reese.
Okay, so I'm Audrey Dickinson. I'm the mental health data analyst for Pitkin County Public Health, and I'm going to present today on the current status of mental health. So just as a little background, I came on board in last April to kind of fulfill any mental health data needs that either public health or the MHAP program that we are doing would need. So next slide, please. So today we're going to go through current gaps in mental health care and services, and then after that, we're going to do successes. So and on a positive note, hopefully. All right, next slide, thank you. As we go through, I'll be citing 4 primary data sources. So the first one is this 2021 Community Mental Health Survey. This happened before I came on board, but we had about 320 responses, so it's the most comprehensive mental health survey we have recently. Then we also have the Valley Health Alliance Pitkin County Public Health Provider and Practice Manager Survey. My colleague Ariel Holstein and I have been working on this the last few months. We're still in the midst of it, so the data is not finalized yet. Then we have the MHAP weekly meeting data. This is data that I've been coding as we have our basically bi-weekly meetings. And I'll talk more about that later on. And then finally, the Healthy Kids Colorado survey data. So we'll be looking at the most recent publicly available data, which is 2021. Next slide, please. So starting off, we're looking at barriers to care. This is the 2021 Community Mental Health Survey. You can see that of the, I think it's 327 responses we had in Pitkin County, the primary barrier to care, of course, was affordability. Second, we had that insurance was too complicated or expensive. And the third most important reason was that other needs were more important. So these were kind of the other competing like life factors. And so if you could keep these 3 things in mind as we go through, these are the trends that we'll be seeing. Next slide, please. So within the 2023 Valley Health Alliance Provider Survey, we had 17 provider responses, as well as I believe 9 practice manager responses. In this question, we had 11 different potential barriers, and we asked the providers to rank them based on their perceived importance. So again, coming in first with an average ranking of 1.5 was finances. The second most important thing that was cited was a lack of knowledge of available resources by patients. And third, we had an inability to make and keep appointments due to work schedule. So again, those life factors.
Justin,
Sure.
are addictions included with mental health? Because addictions to alcohol and drugs is classically a cause of mental health problems.
Yes, we are absolutely looking at substance use, and that will come up more in the MHAP data. This specific survey was more looking at behavioral health than substance use. But we did ask about that in a few
And
questions.
recidivism for those.
Yes, we are working on metrics to track that. We don't have like anything perfect yet, but we are working on that for sure. Okay. So these are the MHAP data themes. So this is the bi-weekly meetings we are having. We began true case conferencing at the end of June. Since then, we have covered 15 individuals, and there are 36 individual topics I've been coding the notes to. The most common topics we're seeing, 8 of the cases involved unhoused specific issues. 7 included substance use, which is kind of one of the sticking points we're running into because it's hard to do identified information due to 42 CFR. It's a Colorado statute that makes it very hard to share identified substance use data. And then 6 of the cases each involved court case and justice system involvement, Medicaid, Medicare, and then the overnight shelter. So the main theme we're seeing is that the individuals who are brought to case conferencing are high utilizers without great care coordination. And this is care coordination both in terms of mental health care along that continuum, as well as social determinants of health. So access to food, housing, employment, all of that. And then we're also seeing that there's a lack of understanding of resources, both on behalf of the patients as well as the providers. Next slide, please. So here we have just a quick snapshot of some mental health metrics in the Healthy Kids Colorado Survey 2021 data. We have received 2023 and we're working on preparing it for visualizations. Looking at this data, you'll see Aspen High School in the blue and statewide in the red. We are pretty close to the state average in a lot of these ways. The only one that was statistically significantly different was that more Aspen High School students report that they felt they had an adult who they could go to with help for a serious problem than the statewide average. So that is good news. So like I said, a few slides ago, we have these kind of three themes we're really seeing. The first being finances. This was ranked as the most important barrier both by community members and providers. The second being a lack of knowledge of regarding existing services. So we are finding that we do have a lot of the services that individuals need, but it's hard to make sure that they're connected to them properly. 32% of respondents to our community mental health survey said they did not know where to start if they needed mental health or substance use support. And then there's this lack of coordination. So again, both mental health and social determinants, and that's really something we're working on in MHAP is care along the whole continuum. And finally, yes.
You mentioned Healthy Kids Colorado.
Sure.
Which goes to the school district, with Theron Mulberry. And do you have any comments about that? Because remember last year, the rates for Pitkin County or Aspen seem to be high.
That's the same survey that we talked about before. They just took it again this fall. We do not have the 2023 data yet. But we looked at this survey data.
So they actually, CDPHE got the data to us very quickly, but we're having to work with the school board to make sure they're comfortable with us releasing it. But they were
I'm
comfortable.
on the school board.
Oh,
I
really?
haven't seen the data.
The 2-pager that was presented at a school meeting, Raleigh Bacharach and I put it together. I can send it to you.
The school board?
I gave it to Catherine Sand. Okay, interesting. Good to know. I know Taryn Sand. But yes, I will work on getting that shared out broadly. But we do have that data and it is looking better. So that is good news.
And I think, Krista, we're just really sensitive to it because the school essentially
We need to.
is the owner of that data. So until. Right,
But is it available?
No, it's not available anywhere until it gets vetted by the school and then we get the okay to share it out. But I think it's just an example of making sure we're going through the right channels first. So that's, Karen was comfortable in me saying it's better. And so finally, the other life factors. So again, that's that difficulty managing appointments with childcare, transportation, schedules, etc. And now we'll look at some successes. So the first one that we have is looking at finances again. So we have a mental health fund, and between January 2018 and August 2023, we did have 273 requests granted. You can also see that 2023, that data only goes through August because that's when I received it, but it's still close to the highest yet. We are working on getting data on how much financial support was granted with each request, but we don't have that information yet. Next slide, please. Here I broke out the 273 requests by precipitating reason. So you can see kind of the spectrum of mental health concerns. Unsurprisingly, anxiety and depression were the primary reasons cited. One thing of note was that we had almost 3 times as many female requesters as male requesters. It's interesting to note as we try to publicize that fund a little more. Okay. And then we have these mental health access program biweekly meetings. Since June, we have case conference 15 individuals and 13 different case conference meetings. Throughout these programs, we've had 21 organizations represented by 37 different individuals. And in this program, we did a survey to see how the program was going, what could be more helpful. We found that educational opportunities were really important, kind of filling those gaps in knowledge. So we've done 3 of them so far with plans to do more going forward. You can see that chart just shows the age breakdown of individuals. The majority are adults aged 19 to 69, with 3 youth under 18 and 1 senior over the age of 70. Next slide, please. Thank you. And then we'll wrap it up with funded organizations. So the first one is Aspen Hope Center. Y'all probably know this, but they're funded for 4 full-time equivalent clinicians for in-school support.
This data here shows the 2022-2023 school year just for the one clinician at Aspen Community School. She reported 12,107 total interactions, with 248 of those being individual level, the rest being group or community education. Next slide.
Who's funding these?
Yeah. So Pitkin County Public Health
It's funding.
It is a collaborative funding effort, so Snowmass, Snowmass Village, Pitkin County, City of Aspen, School District. Aspen Valley Hospital, thank you. We also received this year some funding from Rocky Mountain Health Plans.
And who manages the mental health fund?
It was Aspen Community Foundation and now it is headquarters.
It's who, I'm sorry.
Headquarters, used to be called, used to be Aspen Strong.
Right, okay. Mhm.
The student numbers seem to be accessible, but adults. What you expect,
Sorry, for which, for the last slide?
the total number.
Oh, for-
12 students, but I think you had 254 or so for.
So 248 individual level interactions. Those
For
were,
adults, it's small.
They're mainly dealing with
That's case managed by the.
I think
it's
that's-
just-
students.
yeah. So just students,
So this is the problem. We have this funded in our schools, so our children luckily they pay, but don't have funding sources. But if communities complaining that financial barriers, whenever.
and then I did just receive a pre-mid-year update for the 2023-2024 school year. So far, they have served 312 students in Pitkin County, so at all schools, not just Aspen Community School, including 3 crisis evaluations. And below, you can see the most common reasons for referrals, so family conflict or divorce, general anxiety, neurodivergent concerns, mainly ADHD, and then a family history of trauma are the most commonly cited reasons for referrals.
Can I ask a question just about neurodivergence, ADHD? Neurodivergence, a term that's still quite new for me. And I'm trying to, how long have we been tracking that as a discrete referral category? You could say forever, and I wouldn't know. Just it's new to me.
I'm not sure about the categorization. That's more on the clinical side of things. And these are just some of the categories that the Aspen Hope Center has provided to us.
Just wondering if this is going.
Yeah, I think it's on this is what. ADHD have that. I was with obedience issues. That mechanical neurodivergence.
Our second funded organization is Mountain Family Health Centers. So we have 5 full-time equivalent funded positions here. These are behavioral health specialists and care coordinators. I met with them this morning to collect more data, so we should hopefully be getting that, I believe, early next week. This is the data they did send me. This is between, I believe, November 2022 and December 2023. They had 611 total behavioral health patients in the data they sent me, which accounted for 2,256 total encounters. And then there on the right, you can see the breakdown of insurance. And if we go down to the next slide.
This is Family Health Centers, so Mountain Family Health Centers, the closest is in Basalt.
The Basalt one, yes, sorry.
So this is
Basalt.
not Pitkin County data.
No, it's right, the Basalt office.
So this is hard to know. This is our entire valley, 600.
And so when one of the data points we're asking for is zip code or town. So we're hoping to be able to kind of hone in more on Pitkin County. If we look at unique patients versus encounters here, you can see that 29% of the patients had Medicaid, but they accounted for 39% of the encounters. Whereas if you look at the uninsured rate, that was 44%, and they only accounted for 25% of encounters. So it is an interesting look at how insurance affects how many visits an individual takes in. All right, great. Then we have recovery resources. They're funded for their intensive wraparound services. They have 2 full-time equivalent case managers. Between January and September of 2023, when I received the data, they had 221 total enrollments.
Why don't you just describe what wraparound services is?
That is a great question. So wraparound services with recovery resources, this is primarily their overnight shelter. and day shelter.
Yeah, and they're, I think seeing case managers, which are treated as social workers, I think are what they really refer to as their wraparound services. So whether the individual is accessing detox, whether the individual is accessing shelter. The folks that we're funding are in the shelter. So this would be making sure that they're accessing those case managers who are hopefully doing some motivational interviewing, figuring out what their challenges and barriers are, where they're ready to engage and work towards.
And I'm sorry, this is really kind of off topic.
Yeah.
Do we know, where do we have current inpatient rehab? Like, did they get that place up and up? Glenwood? Do we have access to a detox facility?
So they are launching one in Glenwood Springs that has a higher acuity, hasn't launched yet. We're working on another data request to see how many patients would be referred from ABH to there, so.
And that's the closest one that we really have at that level of services for that uses.
For detox services, there are some in Grand Junction, there's some in Denver. We have, I mean, there is a social detox currently in Pitkin County. Services building outpatient. For beds. But there are, for Pitkin County, they are starting to have a relationship with the telemedicine facilities that they can offer some of the meds. So we're working through that, but there's a whole very separate element designated by the behavioral health, and that designation might be changing in the future, so the services might be changing. But currently, there is resources just to say overnight staff. Medical staff is telemedicine. They have access to medical staff. It's medical specialty. So it's yeah.
I did have a client patient that just came to my list office in the meeting detox and cabins to go to help. And they ended up shutting down, which was to this, I would think that the facility it's in charge of that to just
but I can't tell you exactly what that, these issues. Perhaps cooperating. Maybe.
It's interesting.
There's rock things that it's not special. Sort of these successes. So again, we are educator, we are seeing them help some in study 3 individuals and answers in care. The lack of knowledge of existing resources both by clients and those educational opportunities to other providers and other care for their patients. And finally, other factors and solutions health. Increased care coordination that we're going to be underway as we continue to face effects and with social media work in the space as well. And that's the next slide as well. So, any questions?
Very concerning. People's things being on especially the prices. It's not really nice to be wrong, they're just.
Now have 244. It's called natural healing. So here's whether it was to be classes and other such as just like lots of three categories of the practice, PhD titles, should be PhD, and just research. And the real songs would be a young couple of songs, sure, 450 people that psychedelics, and there was a conference in Edinburgh, which 40,000 people. Just I got them all, so I told him, I see some responsible, or it's like, take that. Experience. I'll say more. This is kind of terrifying to me because there are some people that it's being fun. It's as our creation opportunity, and there are others that simply have helped with the times and all the forms that are and I no perfect one was sorry. So just things that going on, know about it, locking up.
That's things like already had some of our I've already advised, like that's me examples of soul battles, fighting frustrations, possibilities. Those makes sense in the project, kind of say. I think that it's really important to make sure issues yourself help you process the very, very interesting stuff. There's a lot of work for you to enjoy. Just have higher quality access. So I think with helping utilize the that's proper oversight. Thank you. Needs better oversight.
First, looking to, they were still at odds with who was taking ourselves like that statement. And we did some digging into where they ended at Florida is actually over. They're having us start to that's changed. That was, they decided that's it was like
Rejection. That's okay, we need to come to the fortunate still okay, we're going to yeah. I now tonight. And I say something, staff or this is an opportunity to share ideas and I just wanted to say I'm really grateful for it seems like consistent with us and I'm hoping that this is something of the oversight and certainly that I see
conversations. Also, here on stage, that's what I'm thinking. So, that's my share for it. It's just come, one day out here. So next meeting is April 11th, 2023. Very possible moving downtown, which is our next meeting is perhaps more specific now. Try to make them a general topic.
And we can look into that as well.
VSCs and, you know, you can make sure outside.
And you interested in this is also a real conversation to, but monitoring testing at work or.
Because one of the places would be, something like at the, I don't know. Just finding housing also funds there. Stop those efforts.
And maybe we didn't have been talking about maybe opportunity in the future for the board to doing some making a recommendation around air monitor quality monitoring. And we just need to understand what the timing is to be able to have that presentation with the current recommendation that may be possible. Or I don't know if you got all the merits on about the conversation. Just suggest when that might be coming down.
Jordan, I can just barely make out my name, and I think you're talking about air quality, but that's about as much as I got.
Yeah, okay, I'm right in front of the owl.
Oh,
Does this
hey,
help?
now that's better. Yeah, that was helpful.
Okay, I will sit here. So I think the question was around, Dr. Kurt was interested in having us give a presentation more around potential air monitoring. I mentioned we currently monitor around PM 10 and PM 2.5, but he was also interested in ozone.
There's the city of Aspen has an ozone monitor. I believe it's on Cemetery Road. We, the county, do not have one, but that data is available on the city's website.
So we might, we can probably put together just what's available, and who's kind of looking at that and taking the responsibility to monitor that. And then the other question was, this kind of aligns with the airport conversation and the potential invitation of Amory Levens. And knowing that there could be an opportunity to do have the Board of Health make a recommendation around potential air quality monitoring in the future. And so we were going to try to time it so that we could give the presentation where there was an action attached for the board, as opposed to just an information only session.
If I could, just a little background, and thank you for bringing that up. I think we've been interested in this for a number of years, and it has always moved slowly, perhaps because there just wasn't enough interest. I'm not quite sure why, but I would love to have a straw poll from our board today on just how important that you think this may be. And if we do it, let's light a fire under it. And I'd love it if Kurt and team would be more aggressive in trying to, find out what has been available to us and what could we be doing? How can we answer some of these questions? Because these are questions that have been coming to us for a few years now. And I don't know, I don't want to presume anything, but I'd love to know if the board thought that that is something that we should be asking for.
Part of my background includes some of that because I was an NIH fellow. I'm familiar with camp stations in Denver. The continuous air monitoring program, the EPA that's implemented through the CDPHE. It would be great to have something of that sort on the western slope. In Aspen, considering the kind of international clientele we have coming in here, and monitor a camp station equivalent on Main Street. For instance, the dust that's on Main Street is an issue. I took my car on to continue recirculate anytime on Main Street because of the simply all of the dust. Not sure that other factors are involved, or the public really needs to know, because those factors are connected with cardiopulmonary health.
Right. If you were to propose something for this board to vote to do today with us in a straw poll, how would you frame that as a motion or as a proposal?
Let's take a look at a camp or continuous air monitoring program equivalent for Aspen and Pitkin County at strategic locations that are located where centers of pollution might be higher, such as Main Street.
Okay,
And button-up stuff.
And the Buttermilk corner.
I'm pretty sure the city either employed some VOC readings for the lumberyard project, and they might still even be monitoring it right now. It'd be great if we could coordinate all of
Yeah.
this. Yeah.
That's right, let's get a
And
comprehensive.
maybe even wanted to Brush Creek Park.
Yeah. So maybe we could come back with what's currently, what the current infrastructure is and, for air quality monitoring.
Maybe
And
something.
Aspen and Pitkin and some data, and let's start to see what we've got. And we can do that. We'll try to see if we can do that for, the next Board of Health meeting.
I'll be here.
Well, if you're not gonna be, I know Greg, this is a big interest, we can make sure we push it to July. That will give our team some time to look into this as well.
Yeah, I think that makes sense. Let's talk about the current infrastructure, Jordana, just to make sure I heard you were correct. And then potentially, if we're doing this in July, we may also have some more information on the airport project as well. It's in the infancy as it is right now. There's not a lot to report on there. So hopefully we would have both. To be able
If there's anything you can disseminate to us now in April, that would be great. It seems like a long time in July. It's 6 months is a long time to wait.
We'll be sure.
It's been, people have been requesting this for years. You know, public citizens have asked for more information. And so I think, why don't we provide this? Why don't we do this soon?
And also, I just want to throw this out. It should be done 24 hours a day instead of just spot time.
Yes.
Because at certain times of the day, the airplanes aren't taking off.
Camp means continuous air monitoring.
Yeah.
Excellent. Thanks for.
So I think we have direction from the board to the staff.
Perfect. Other topics that have come up in the past that I'm curious, if the board is still interested. There was a mention of having, Tom Dunlop come and present on smokable. Does that continue? I know BOCC has gotten a lot of presentations, although I think he has started this one. So just wondering if that is of interest to the Board of Health.
We need to be conscious about contamination. Time. In part because of that might lead to more monitoring. So every ground time here about the concern about that.
Right, yeah, I think one of the topics of concern we have where it's just that the state won't allow us to use soil. We can kind of use that to cover the landfill. And all of a sudden, the cost of the soils from the fun site way up, so. Might have been 10,000 was New York. 2 years ago is now going up to spend 30 or 40 or 50,000 to remove the sinking under. And landfill that has to put it in the landfill, which is going to end our landfill's life sooner. So we're putting the dirt in the argument that I've heard for so many years that this is kind of a line stretching and perhaps it's over. I don't think we've ever had a case of like the places in North. With lead levels, that led one day, I heard about was a kid who was playing around something like that. But it was terrible.
Freaking riding bicycle. That was an excessive. Look at him, small so lost all that. This like that. I'm trying to if I can discover the models.
So it sounds like, you know, we have a supervisor, we have a village that we are forward to do, but to that the board isn't necessarily in, or maybe it's announced that.
It's not.
Thank you. Okay, I think it. It's
I just mentioned earlier, I just want to let the board know that we will most likely be responding EOC, as the operations center, is actually activated, and public health be participating in that in response to the growing number of different sources in the area. So if the session is out, we'll include information in our updates that is public health we are engaged in and already it's an issue across the state. We know that migrants are in Boston, Denver, they're making their way out to other parts of the state that have good jobs. So there will be more work for us around that in the near future. And then I also just wanted to thank all of our board of health again, and it's the annual time for calendars. Like a calendar that should sit there. So for
contracted in certain places, there's a response and the active in this case, regarding the minds we can help. If I want to thank friends, my fellow commissioner, this is our they're all staying just on our own time, which is remarkable and the case as a response. Not the LCC. So we shall know that we have a response.
Specifically to the Gardendale population. That's the size so much.
Yeah. It's tough. Just scary. Thank you. I do not remember if I need a motion to adjourn, but I think if for the second, like that, all in favor. Thank you all for your.